That money is going to insurance companies to prop up insurance companies. That money is going to insurance companies to lift up their stock price.
No, these were payments to insurance companies to make sure that hardworking Americans who don't make a lot of money can have their co-payments taken care of.
That was Republican Governor John Kasich of Ohio yesterday calling out Donald Trump's lie. That's right, lie that he was cutting federal funds to insurance companies because the insurers were the sole benefactors of that money. In fact, the $7 billion a year insurers receive under the Affordable Care Act is used specifically to subsidize low-income Americans to help cover their deductibles and out-of-pocket costs that they could otherwise not afford. The move comes just 2 weeks before open enrollment begins, leaving insurers two options: pull out of the ACA or raise premiums.
His effort to gut these subsidies with no warning or even a plan to contain the fallout is breathtakingly reckless. He said himself that he wanted to see Obamacare explode. Well, this is an effort to blow it up, and we're not going to let him do it.
Now, New York has joined more than a dozen states in a lawsuit challenging Trump's actions, saying the fallout will leave millions of Americans uninsured. Now, former White House aide Steve Bannon spoke at the Values Voters Summit over the weekend, where he said Trump is intentionally trying to blow up health insurance markets.
Yep. Yeah, Treasury Secretary Mnuchin said it's going to be a middle-class tax cut, and it's going to have the small business tax cut. This is going to be middle-class and for working-class people, I guarantee you. Then you had Obamacare, not going to make the CSR payments, going to blow that thing up, going to blow those exchanges up, right? And lo and behold.
All right, then, of course, now, will it be enough to stop Trump's obsession with destroying President Barack Obama's signature law, or will both parties in Congress join forces to work out a bipartisan health care deal? Joining us right now is Ashley Allison, Senior Advisor at the Leadership Conference on Civil and Human Rights. And of course, our panel, Eugene Craig III, Republican strategist and CEO of Eugene Craig Organization, Monique Presley, legal analyst and principal at the Presley Firm, and Douglas Sloan, principal of National Capital Strategy Group. So it's clear here what Trump is doing. He wants to strangle and starve to death all of the components of the Affordable Care Act. Now he wants to kick it back to Congress and say, okay, I've strangled it, now y'all do something about it.
Correct. This is politics 101. When the Obamacare Act was passed, Affordable Care Act was provided.
Yeah, because here we don't call it Obamacare because that was purposely designed to shame it and to destroy it by attaching his name to it.
But we always say Obama cares. So
yeah, but that's still that was still a Republican poll-driven word to purposely destroy it, and that's what it does. I mean, bottom line, they hate Obamacare but love the Affordable Care Act.
Well,
they hate Obama.
That's true, but what the Affordable Care Act does is provide many and millions of Americans, and it has over the last couple years since enrollment has been possible, to have a pathway to get access to affordable health care, to make sure that you have access to see your doctor when your child gets sick, to make sure they can take care of themselves, and really not face the cost and the high cost that happens when people get sick and you don't expect to get sick. But what the president is doing, Trump, he is playing politics with this right now. He is not thinking about the American public. He's thinking about this unnecessary competition between President Obama and not thinking about the American people he was elected to serve. So
what we're also seeing here is that the people going to be hurt most are the folks in the states that Trump won. And I'm sorry, these are dumb, idiotic white voters who are screwing themselves, and again, because they hate Obama, but they love the Affordable Care Act.
Yes, what President Trump did was irresponsible this past week because the open enrollment process happens November 1st. Americans have the opportunity to go and enroll in open enrollment on November 1st, and they should. They also should call. He punted to the Congress to pass. There's an opportunity for bipartisan law to be passed to make sure that we save the Affordable Care Act. So people who voted for Trump should also call their senators, their House representatives, and make sure that they create a pathway for the Affordable Care Act to remain intact.
Yeah, I agree. Obamacare is broken. I think Trump, further,
Okay, hold on. No, stop. Okay, you say the Affordable Care Act is broken. Specify that.
Specify. Over the last three years, premiums in states like Arizona and other states have gone up over 100%.
Some premiums.
Some premiums, but still premiums. These are still families that are going to be affected by these premiums. You know,
insurance premiums are going to go up anyway,
no
matter what type of health care plan you're not in.
I mean, they are.
The Republicans are acting like they're only going up under Obamacare.
They should not be doubling over a matter of a couple of years. I mean, I think we all can agree that that's harmful. You know, even the 10% increase is harmful. You know, so families are being hurt by insurance premiums.
Oh, no,
I mean, we were all told if you want to keep your doctor.
Hold on. You said failing. Okay, so one, you said premiums are going up places like Arizona. What else?
You were
Specify.
You were told if you like your doctor, you can keep your doctor.
Well, we're back to that.
We are back to that.
Many people were able to
What about now?
We are back to that.
What about now?
Okay, hold on. No, wait. What else?
A lot of folk were not able to keep their doctor.
Okay, you got that one. That's two. What else?
Thirdly, when it comes to portability and accessibility, we have counties that have no insurance policies available.
Now, that's three. Okay, can you respond to those so we can have facts?
Well, those are facts.
1 second.
The reality is that more people actually have doctors because of the Affordable Care Act, because more people actually have access to health care. The other reality is that what President Trump did last week is not going to have costs be more affordable for the American public. It's actually irresponsible, and it's going to provide an opportunity for he broke this affordable health care by doing the actions he did last week. So if you want to say Obamacare or the Affordable Care Act is broken, that's not correct. More Americans have access to health care than they have ever had before. And President Trump's
having access to health insurance you can't use it doesn't do any good.
Nobody's saying that the Affordable Care Act is perfect. Everyone acknowledges that.
I think we're all agreeing that it's
the actions of
broken.
Trump things that are not perfect are not broken. Those are two different things.
Go ahead.
You are not perfect, but I would not call you broken. I am not perfect, but that doesn't mean that I'm broken. I still have function. I still have use. I still perform. I still provide benefits.
Everybody on this panel.
Go ahead. Hold on. Go ahead.
It's the other 2,000.
Go ahead.
Still talking. The Affordable Care Act, as she just said, has provided insurance that they can use, Eugene, for millions of people. And I know you and I have had the same conversation before. I'm disappointed that you didn't hear me the last time. I am an example of a person with a family member with a pre-existing condition who would not have insurance but for the thing that President Obama caringly did, which was push forward the ACA. My child is not alone. There are millions of those examples. So when you just push forward that talking point, Obamacare is broken, like we're zombies who are just going to internalize that and not just say then that your president now is not just being irresponsible, but is being hateful and cruel and un-American and doing everything but what he swore an oath to do by turning on his very voters and keeping them from being able to be healthy.
Douglas.
Those are the facts.
Douglas.
Yeah, I mean, I think we can all agree that Obamacare does need to be tweaked, that we do need to continue to work with it. It does not need to be scrapped and thrown away, as Monique Presley said, that it has helped thousands, millions of people get health insurance. And what Trump is doing now is trying to blow it up and undermine it. He's not funding it. You have to work with this thing to get it to work properly. And the thing that always blows my mind is Republicans come up and say, oh, it's broken, oh, it's horrible. Originally, Obama did base this on what Mitt Romney was doing. Mitt Romney was doing up in Massachusetts. Yeah. So this is really a Republican plan.
So here's my
statement was that
cared about his citizens.
My original statement was that Obamacare was broken, and Trump made it worse.
Right, but Obamacare made it worse.
So 1 second, because we're repeating the same thing. I'm not trying to hear the same repeating. What's next?
Well, Americans can enroll in the Affordable Care Act starting November 1st, and they should. Hopefully, this president will have a come to Jesus moment and realize that making irresponsible action.
That ain't happening because he don't know Jesus. Despite the lies this weekend, the values.
I don't know, Michelle.
Then they should make their voices heard to Congress.
What we're seeing also are other efforts to get folks enrolled because he is cutting the budget,
yes.
does not want to tell people, does not want to advertise, and so you happen to have third parties who are actually trying to do it for the government instead.
And he's restricting people who actually work for Health and Human Services in states from doing outreach to consumers, which we know is an important part of getting people to enroll. So they should make their voices heard to their legislators in the state level, their governors who can have the opportunity to expand Medicaid, as well as to members of Congress.
Okay, all right, we appreciate it. Thanks a bunch.
Thank you.
Weekdays on TV One.
I will never lie to you.
Oh my God.
Roland Martin.
He doesn't want to talk to us. He wants to ignore us.
Uncensored.
Hell no. That ain't gonna cut it, boo.
Unapologetic.
No, that is fundamentally false. You are wrong.
Unfiltered.
He wants an America where we all look alike. He ain't talking about black people.
Unrelenting.
You better go work out, because you got a fight on your hands.
NewsOne Now with Roland Martin. Weekdays at 7 a.m. on TV One.